My dear Maha, over to you.
Thank you, Bruno. In the name of the Father, the Son, Holy Spirit, the one God. Amen. I know it's probably unusual to have a PR consultant talking about dementia, but I work for an organisation called Belong, and they run dementia care villages. And one of the premises of these villages, they are care homes, but they also have a lot of facilities, a gym, a bistro, lots of things. And the premise of the villages is that everybody who works in them needs to be trained in supporting people with dementia, so that if people go into the bistro, they're going to be dealing with bistro assistants who understand what might be happening with people and can be properly empathetic. So if you work as a marketing consultant for this organization, then you have to be trained to understand dementia. And so that's my context. I've worked for them for 15 years, and I went through the same training that their care workers receive. And obviously I don't pretend to have the experience of somebody who's worked as a frontline carer for all those years, but nonetheless, having some kind of understanding so that when you're in a village and you're dealing with people, you can support them in an appropriate way and respond in an appropriate way, is very much part of the ethos and the philosophy of the organisation. So I'm going to cover what dementia is and how people experience it when they're living with dementia, as far as we're able to understand that. But also how we understand the behaviour that we see, because I think often people make assumptions about behaviour that without necessarily understanding what's triggering it. And I think, anybody with children will have that same experience, that we often respond to a child's behaviour rather than and get angry and annoyed and frustrated at what we perceive to be, in inverted commas, bad behaviour, without thinking about what has caused them to behave in that way. And it's very similar with dementia, that we are encouraged not to respond to the behaviour, but to look at what's going on with the person. And I think it's fair to say that dementia is still a little bit stigmatized, that people aren't very comfortable with it. People have lots of labels about what, and can, I think, in some senses, be embarrassed as well about how to deal with dementia. And, we don't necessarily think about how that feels for the person. And lastly, most relevant probably for us, is how we respond to people in the church. So as the body of Christ, if we have brothers or sisters who are going through this experience, how we can respond to them and support them in really as Christ would. I think that's our aim for all of us, that we are all created in the image and likeness of Christ, whatever challenges we're going through. And so how we can walk together and support one another through whatever people are experiencing. But before I get into the medical side of it, if you like, I just wanted to start by saying that the most important thing, and it's the most important thing in Belong, in the organisation, if you're working with people with dementia, one of the underlying values that the organisation looks for when it's recruiting people is that they are compassionate, because it's very much believed that you need to be able to walk into someone else's shoes. The word compassion comes from the Latin to suffer with, and I think you could say to walk with that person, you need to have some empathy with them. And of course, we see that most of all in Christ. And there are so many different verses where that comes across, where he came for the sick, he came for the suffering, he came for the people that were ostracized, the lepers. And I think, sometimes in our society, people with dementia are seen a little bit in that way. They're shut away in care homes, and people are embarrassed by their behavior and don't want to engage with it. And I feel quite strongly that Christ would have wanted us to, he would have certainly engaged, he would have touched out to them with pity and compassion and love, and that's what we would aspire to do too. So I wanted to frame it in that way, that we want to be like Christ, and Christ came for all those who are sick, and dementia is an illness. So that's what I'm going to come on to now, what it is. It's a collection of symptoms. People often sort of recognize it by the decline in memory. That's what it's famous for, that you start to lose your recognition of people around you. But it isn't only about loss of memory and that loss of recognition. It can be loss of reasoning, communication skills, and the skills that you need to live daily. And it is important to say that it's a physical thing. It's I think because it's a mental illness, people don't always think of it as physical, but it is a disease, and it's caused by chemical changes in the brain and a degeneration in the brain. It's increasingly widespread, and there are lots of forecasts about how that trajectory is going, that it won't be long before everybody knows somebody with dementia if they don't already. It's a great, and it comes with aging. So as the population gets older, it's inevitable that people living with dementia will become more common, and it's something we'll come across more often. And it is recognised as a terminal illness. So it says there 4 years is the average time from diagnosis, and I think in a care setting, the average time that you would see usually is about 2 years from when someone's needing 24-hour care. So it may not be that they die of the dementia, that they die with it, but the decline that it causes is quite rapid. And I think that makes it very difficult if you have a relative with dementia as well to go on that journey. It isn't there a one thing, that's the other thing to say, because there are different parts of the brain, and depending on which part of the brain is affected, there are different types of dementia. Alzheimer's disease is by far the most common, nearly 2/3 of cases, and then vascular dementia is the second most common, but there are some others in there. And these are some of the most common symptoms: the difficulty with recognition, changes in social behavior, difficulty carrying out tasks. And that's why people end up needing 24-hour care, because even things like getting dressed can become very difficult. Being stuck in a repeated activity and losing that sense of time and doing things over and over and over again. There are some of the things that people experience. And this is a picture of the brain that shows how, depending on which part is affected, we don't need to go into the sort of whole medical side of it, but the temporal lobe, the front lobe, that's where probably the most common, where people lose their memory of names and faces and have trouble communicating and recognizing people. And then the parietal one, I think, is another really common one, where people's perception of things change. And then the frontal lobe, where it's more about your planning and decision making, and that you struggle with those things, and you see that's where the personality changes come in. So it isn't one thing, and that's important because to know, just from the point of view that when you're responding to people with dementia, it isn't the case that what works with one person will work with another person. That even beyond the types of dementia that people have, people are all individual, and it will affect different people in different ways, and there'll be different impacts, even to the extent of things like swallowing and the very physical things, but difficulties with balance and posture. So it all very much depends on which part of the brain is affected as to how that impacts on the daily living of somebody. And they're just a few examples brought to life as people, that if someone has short-term memory loss, they forget explanations, they might forget why they're in hospital, or even the fact that they are in hospital, and be asking where other people where they are. It can be around visual impairments, how you perceive the world. So, for example, you never have mirrors in care homes because that reflective glare can cause people a problem. Here it's got the example of a polished floor, because they think it's water and then don't want to walk on it. And the mirror, again, it's just that inability to distinguish between what's real and what's an illusion can be lost. So things like decor and having very simple environments is really important. So the Dementia Village is part of why they were created, was to create an environment where the physical building is actually designed to be helpful to someone. So the very neutral things, not having busy patterns, so patterned carpets and sofas and curtains are all things that actually start to cause or can start to cause people problems. So even things as simple as keeping the environment quite minimal, still homely, but in a sort of more neutral way, is important, and can help someone to feel comfortable and help them to feel less confused. Because at the end of the day, when we talk about the environment, we're trying to create an environment where people feel the name belong comes from this sense of belonging, but where people feel just more at ease and less challenged by their environment. And then the challenges with carrying out tasks, so putting clothes on in the wrong sequence can be an issue. There are lots of sort of day-to-day examples where people come across, but I think it's important to be aware, because I think people can become frustrated by what they think are obvious things or things that we take for granted in our day-to-day life, but that suddenly become very challenging for someone with dementia. These are sort of more examples where someone applies toothpaste to their hair, or I think the next one, the one about social behaviour, is one of the ones that people can find more challenging, that people who might have been reserved lose all their inhibitions, so then they can become either just outspoken and, in inverted commas, make rude remarks, or even aggressive. So again, they're things that can become challenging. And it's not, I think we're always careful not to say that the person's challenging, or even necessarily to describe the behavior as challenging, but to recognize that that it's the challenge is in the person trying to support them, that often it's us who are struggling with how to deal with them, and we project our own struggle onto the other person. So they're just really, there are a few examples of the types of behavior that you might encounter. And then just to recognize that dementia can cause other illnesses, whether that's anxiety and depression, or it could also be that because it comes with old age, the person has some other pain or some infection, which is causing different behaviors and different reactions, but we're not recognizing that because they're not able to communicate, and it all gets merged into one. So it can be complex, and it can be there can be a number of different things to think about, all of which go way beyond the sort of forgetting someone's name or forgetting facts, which I think is the sort of more superficial level that we often think of dementia as. There's an example here really where this is to encourage one to think about what it might be like if you're the person with dementia. So you're sitting in unfamiliar clothing beside a bed in a room with 3 other beds and lockers, and you think it might be a hospital, but it's strange, it's unfamiliar, and you're not sure. You can't recall how you got here, you don't have your keys, you don't have your phone, you don't have any money, you don't know why you're there, you don't know what's going to happen, but you have a sense of dread. The smells and noises and the sights and the people around you that are in uniform or who appear ill are all puzzling and unsettling. You look around, but you cannot see the face of anyone you know. Your mouth is dry and you need a drink. Occasionally you summon up the courage to call out to people who walk by. And those who do stop talk quickly, but a lot of people might ignore you. When you get up, your movements are unexpectedly slow and labored. And finally, when you try to seek a way out of this strange and unfamiliar place, a person in a uniform prevents you from leaving. So I think the question, I don't know if people are up for responding, is just like, encourage you to think about how that might make you feel or what you might think. And I don't know if anyone would be willing to share perhaps what you think it might be like if that was your experience. It's dangerous on the Zoom, isn't it, to ask for interaction?
I'll say a little. I think that often when I reflect on what it feels a little bit like being someone who doesn't understand Arabic, sitting in a community where people are all speaking Arabic. That's not my normal experience. And I can see what is happening, but I don't fully understand what's happening. If everyone gets up and does something, I'm not quite clear what's happened. I'm there, but not quite there. And if people talk to me, maybe in an excited manner, I don't know why they're so excited. I maybe become anxious and a little bit afraid because I don't quite know what's going on. I think that's perhaps one small aspect of what it's like. I'm there, I can see everything that's happening, but I don't quite know what's happening, you know?
Yeah, I think absolutely that sense of fear is very real to people, and that sense of confusion. And I think you might want to be able to find a familiar face, but if you can't find that, that's challenging, or to leave the situation. So this idea of getting up and just walking out of the hospital, but then being pushed back, and particularly people, have lived long independent lives and got used to doing what they want. So that sense that you're increasingly finding your movements being restricted, I think is very difficult and very terrifying actually at times for people. I think a lot of the time when we're ill, we just want to see our parents or our family, or it could be a spouse. So I think that trying to create an environment that is more familiar can be helpful. But I think that's just one scenario that gets across how day-to-day experiences can become very confusing, and that sense that you've lost your independence, that you haven't got your phone, you haven't got a way of communicating with the people that you want to communicate with, that you're increasingly finding your world closing in, and that's part of the experience. So I think I've painted quite a possibly gloomy, and I haven't intended to paint a gloomy picture, but to give some insight into some of the challenges that people may experience. But there are positive strategies that we can use in those situations that can help the person feel better, to feel positive. And when we're supporting people in a care environment, the objective is always about well-being, that the person, instead of feeling frightened and confused and anxious, feels comfortable and happy in themselves. And that can seem elusive, but it isn't. And actually, when you visit the places, it's quite remarkable to see how much joy there is and how much people still can do. And one of the things that we really focus on is concentrating on the connecting to people with the things that are meaningful to them. So there isn't any substitute for getting to know the person, and that always is the starting point, that the more that you know about somebody and the more that you know someone, the easier it is to connect with them. And often that will be around in the long-term memory, because that's where people might have lost their short-term memories, but they can still remember things that happened in the past. So the more you know about that person's background and things they enjoyed, if there was a certain kind of music they liked to listen to, or that they were, they used to play football, or whatever it might be that it has interested them in the past. If we can connect around those things, then that's really helpful. And it doesn't mean that you need to know everybody's full life history, but if you know somebody with dementia and you know 3 things about them, then you can come back to those 3 things and talk to them about something that they're interested in, that makes them happy. And it can be a place they used to visit, a place where they'd go on holiday, but you can usually find things that by bringing up that topic, will make someone smile, in the way that when you mention to someone the name of their grandchild, or if they see a picture of their grandchild, they can't help but smile, because that relationship brings them joy. And sharing photographs is something that often is going through a photo album where there is recognition, can help someone to feel much happier. Connecting to the person is really important. So in the example in the hospital, where everyone around is too busy for you, that none of us like that feeling, that you want to talk to mom, but they're too busy and they're not really concentrating. So the simple things like making eye contact and smiling are really important, and making sure that your body language is communicating that you want to be with the person, not rushing away. And tone of voice comes into that. But essentially, it's around making time for the person and not being distracted yourself, because if you're feeling distracted, people pick up on that really easily. So just being very present in the here and now, especially if the person can't remember why they're there, then that just trying to connect in the moment is really important. And that this follows on from it, really, the slowing down, being relaxed, and trying to keep things simple. And it's similar to having the confusing environment, but just having a calm atmosphere, so that it's less stressy, less anxious, is important. Because short-term memory can be an issue, it's important that when you speak to that person, you introduce yourself every time you see them. And that's something that you can do, that that would certainly apply in church. And I have to say that there's quite a few of us may not always remember the name of people, so actually introducing yourself to people again is important. Reminding them where they are, why you're there, and referring to them by their name as well helps to establish a connection, because it's all about connecting with the person. So if you tell them your name and you use their name, then immediately that helps to anchor them in the moment. Communicating clearly and talking about one thing at a time, talking more slowly, keeping everything really as simple as possible. Giving people choices is really can be really helpful, because there can be lots of areas of their life that they're losing control of. But if it's a simple choice between 2 things that they can see in front of them that doesn't rely on memory, even as simple as if it's tea or coffee or what they'd like to eat, then that helps people to feel more in control. And speaking clearly and kindly, which comes back to the compassion, but that they feel a friendly presence next to them, is something that's helpful for people with dementia. And I think when we talk about people with dementia, we're talking about people, and they're things that are helpful in communication with anybody, that if people feel that when we're talking to them, we're very present in the moment and being kind and compassionate, that's helpful. But it's particularly important where their experience of the world is more limited. One of the things that can be really challenging for relatives of people with dementia is that they lose their sense of where they are. So, for example, I was in a village last week, and the woman was quite certain she was in Putney in London. And we always say that you don't need to correct people if they're they have that perception, because that can become very distressing. You just need to go with the flow of their world, which isn't to say that you're continuing a fantasy necessarily, but just you don't need to get drawn into trying to contradict or correct something that they're probably not going to have the capacity to grasp anyway. So really it's more about giving reassurance, and trying to acknowledge that you can see that they're upset if they're upset, and try to find a way of moving them to a more positive state of mind. And often those things, because the sense of time and place are both quite challenged, they're sharing things in the moment. So like we talked about the photo albums, another great one can be music. So in the homes, they always have an Alexa, so they know, and that links to the knowing someone's favorite songs, and it could be knowing their favorite hymns, but that we use music and singing and things that are very familiar to someone, and don't rely, and they're more sensory, and they don't rely on memory, and they don't rely on knowledge. So music is really helpful. And the things that are helpful will depend on the person and their interests. Gardening can be really helpful. Going for a walk could be helpful. So it very much depends on the person and what they enjoy, and what's going to give them that sense of well-being. Keeping things quiet, I think we talked about, and avoiding the distraction and confusion, and not arguing or with the person, trying to respect as much as possible what they're saying and what they're doing, rather than telling someone that they're wrong, and keeping all the interactions as positive as possible rather than focusing on negatives. So the engaging, encouraging, finding meaningful activities to share, which is what I've started to talk about, focusing on the things that they can still do. Some people like dancing, some people like art, and they're all activities that you can do that don't rely on any memory or cognitive. Some will depend on how much on other impacts of the dementia or older age, but usually there are things that you can find which will help the person to be engaged. And talking with others, that can be more in a family context. So if there are a few of you supporting a member of your family, and you've spent time with the person with dementia and you found things helpful, then definitely sharing that with other people in your family can help. But even I think it's important to acknowledge that supporting someone with dementia can become really stressful. And there's two sides to that. Sometimes the challenge for the relatives is because they're always comparing the person now with what they used to be, whereas for the carers who are in the care setting, they don't have that memory of the person of the past. So it's easier in a way for them to respond to the person in the here and now and as they are today, without any of the kind of feelings of loss that the family member might be experiencing. And while it's natural, I think, for people to have that sense maybe of sadness of things that are lost, it's really not helpful to the current situation. And I think the more that people can let go of the past themselves as a relative supporting someone with dementia and concentrate on what they can do in the current situation, the better the interactions and the better the quality of life are going to be. And I think when you go into the care environments where it's done well, you honestly just see so much joy and so much love between, and so much kind of enjoyment of that really you can see how, if people are able to let go of their expectations of what that person should be doing or what they used to be like, then you can make the present much more positive for them and and ultimately for you, because you feel that you've had a positive interaction when you've been with them, rather than constantly being stuck. Because it isn't necessarily just the person with dementia that's stuck in the past. It can actually also be people around them that are stuck in the past of thinking what they used to be like. So I think the more that people can get support, and it's not to say at all that it's easy, but there is a lot of specialist support out there, and I've put a few logos at the bottom. So the Alzheimer's Society obviously provides lots of resources and dementia cafes where either people in early stage of dementia or relatives can go to talk and get support. There's something called an Admiral nurse, which is like a Macmillan nurses to cancer, but an Admiral nurse for people with dementia and for their families. So they provide support to people when there's a diagnosis of dementia. And I think, you know, recognizing that it is very stressful as a family member, and that you might need support as well as the person with dementia needing support. I think, and in the church context, that when we're, you know, we might be supporting people with dementia, we might be supporting relatives as well. So it isn't an easy thing to go to, but the more understanding we have, the better able we are, I think, to support one another, whatever that context is. And just to sum all of that up, really, I think it is very much around, we describe it at work as being a dementia detective, but learning that, you know, often, and with your children, people you're close to, you often recognize that a certain behavior means, like I can, you know, tell if Oliver gets very ratty that he's probably hungry. And so those things where you can see a behavior and you can connect it with the cause or the trigger of that behavior, rather than just reacting to shouting at them over the ratty behavior, actually going to get them something to eat might produce a better result. And it is very similar that you can, if you can look at what emotion is causing the distress language and try to fix the cause of that emotion, see that they're feeling anxious and confused, and find some music or some photographs or some other activity that's going to take away that feeling of confusion, then you can change the current context. I'm going to skip over this because I'm conscious of time. So I'm going to go on to just to responding as a Christian and as a church. I think some of the things that we can do that are very simple. The first one is around not being embarrassed. I've just seen that there's something in the chat, and I don't know if it's something I need to respond to. I can't, it's not easy when I'm presenting. So, Bruno, if there is anything that is in the chat that I need to respond to, please could you let me know? Otherwise, I'll keep going. There isn't too much more. And then if people have questions, I'll allow time for that at the end. Yeah, so I think one of the things that we can helpfully get rid of is the feeling of being embarrassed, because people can't help their behavior, and it is an illness that they have very little control over, that is linked to the degeneration of the brain, as we discussed. And so and if you're uncomfortable, then you'll reflect that onto the other person, and that can cause the situation to become much worse. So I think that although it can seem strange, and although people's behaviors or what the things they say may not be things that we're expecting them to say, we certainly don't need to be embarrassed about it, and don't need to try to correct them or to kind of get out of the situation. We just, as far as possible, if we can respond with compassion, with love, give the person time, and I think remember how Christ would have responded, that he was very much about reaching out to the lepers. I think if we expect our churches to be places where everybody's normal and professional and has a nice life, and it's not a place where people can feel comfortable if they're ill or if they're depressed or if they're going through different things, then we're not I think we're not living from Christ's image as we would want to. And so as much as possible, just accepting everybody, no matter what the condition, is really important. And I put at the bottom, it's not about drugs, because sometimes I've heard it said that when, you know, we think as a medical community as well, we often think that that's the first response that people rush to, that if someone's behaving in a strange way or they've got mental some kind of mental illness, there'll be some drug that can fix it, and sometimes there might be, but that isn't. So one of the things in the Belong villages is actually the use of drugs is almost eliminated, and a lot of doctors who support those villages are really amazed at how much is done to keep people in well-being without any medical intervention. And you know, and so medical interventions may be helpful, and that's not my remit, and where, you know, obviously GPs get involved and all the rest of it, but that shouldn't be necessary to make somebody feel better. That if, you know, there's a lot of evidence that where you can create an environment that's calm and you connect with people and treat them as people rather than being so focused on the illness, then you can produce really good quality of life. I'm going to move on to that. We use this talk about remembering that it's the person that's in capital letters rather than dementia, because a lot of the time we can become very fixated on the illness and forget about the person. But at the end of the day, people are always people first and foremost, and the more we know that person, the more we respond with compassion and kindness, the better the outcome is going to be. To sum it all up, I'm going to show this video. I think it's about 4 minutes, so it's not too long. And then after that, I'll take questions. Is that all right, Abrina?
Yep, that sounds fantastic. Yeah. Thank you.
Okay. Hopefully it's going to open. Yeah. 35 minutes.
When people are very old and deteriorated and no one enters their world and they're just sitting there, they will withdraw inward more and more. And their desperate need for connection is all now inside. And if a person is all alone, even if they're very, very deteriorated, there's a longing for this kind of closeness. Mrs. Wilson? Hello. You want me to sit? Can you see me good? Gladys Wilson is a wonderful example of a person who is in the phase of repetitive motion, where people use movements, repetitive movements, because they don't have any more speech or very little speech, but they have human needs that need to be expressed. You're crying. You're crying. You have a tear right here in your face. You have a little pain. You want me to touch you. You're very sad. Can you see me? Is it scary? Are you afraid? And if this person sits with their eyes closed, rocking back and forth, and maybe there's a tear coming down, there's a need there. Here. There's a little tear that's coming out. Do you feel it? You feel a little tear? If you gently use touch, and I touched Gladys Wilson for the fingertips right here on the cheek, is where the mother usually touches a child. If you touch an infant there, it looks up, and every cell remembers where it was touched by the mother. And often that person knows, even if they can't say a word at that moment, they won't talk, or they don't want to talk, but there's a communication, and that person is no longer alone. Can you let me in a little bit? You think? Just a little? think I could be with you and Jesus for a minute? Jesus loves me, this I know, for the Bible tells me so. I used music because when speech is gone, music, especially with Gladys Wilson, it was religious music because there's emotion tied to it and safety tied to it. So I used her old church songs. Jesus loves me. Yes, Jesus loves me. Yes, Jesus loves me. The Bible tells me so. What I did was, when she moved, I moved with her. And when I was singing, because she didn't sing with me, so I matched the intensity of my voice to the intensity of her movement. And pretty soon, for a split second, we became one person. Jesus loves me. Yes, Jesus loves me. The Bible tells me so. So at one point, when she got very quiet and very peaceful, and my voice became very quiet as hers and very peaceful, and my breathing slowed to her breathing, she pulled me to her, and I moved with her. And for her at that moment, I believe I was a symbol of her mom. Can you open your eyes now? Feel safe and warm? The whole world in his hands. He's got 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 the mothers and the fathers. He's got the mothers and the fathers in his. He's got the mothers and the fathers in. He's got the whole world. The breakthrough doesn't happen every time. A person will not always open their eyes and look at you. But if you keep trying and you keep centering yourself and really look at that person and really mirror their movements, maybe not this time, but the next time you come, you'll have a communication. You feel safe with Jesus and me.
Do you really like the idea of meditating? Maybe a meditation experience that really impacted your life. Well, I want to show you something that I think you'll find amazingly helpful. Do you often have a little bit of a brain fog, or is your mind...
Sorry. I know that's very intense, and I know that what we're talking about most of the time won't be supporting people with dementia in that advanced stage. But I thought it is such a powerful video to show the importance of connection and the importance of just the importance of seeing the person, really. Abuna, should I invite questions? Does anybody have any questions?
Yes, let's have 10 or 15 minutes of questions and discussion, and I'll start since it gives me an opportunity to. So if someone comes to our liturgies, a family member usually with dementia to some extent or other, what are just a couple of things that we could ordinarily do as ordinary church members, seeing someone we care about with an older mother or father? This happens to me often in my churches. What's one or two things that we could do, both to make that person feel comfortable in whatever way you think we should describe that, and also to make the family bringing that person feel comfortable and supported?
I think with the person themselves, it's the simple things around saying hello, around introducing yourself, around trying connecting to them, offering people a drink, just the really simple things that they might not, that other people might not do because they're too embarrassed, or they don't want to go up to them because they're not sure how they're going to react or what might result. So the thing about introducing yourself using their name, just describing simple things around you rather than asking questions about, you know, where they've come from, or don't, you know, avoiding asking questions that could be difficult to answer, but just commenting very much on the sort of things that are immediately around, like offering someone a drink, for example, just the very kind of simple hospitality things. And I think with the relatives, it's around, it depends how well you know them probably, but just around showing the same kind of kindness and empathy, for them to feel that they've got an ally or someone that can help them in supporting them, someone that they do. I think it's, you know, people can become very self-conscious about behaviors or about worrying about what someone might say or what someone might do. So I think if you can give them a sense that you are, you know, happy to see them and happy to see their relative, then often that's as much as they need, that they feel welcomed and happy, you know, and just feel welcomed and comfortable, and that you're trying to include them as much as possible in the community, whatever the community is doing, whether that's praying together or having a cup of tea afterwards. You know, simple things like offering a biscuit or a choice of biscuits can, you know, that can create a conversation around what someone's favorite foods are, for example, things that are easy to talk about, which don't require too much reliance on memory.
So I mean, if we see someone in the church is elderly that we know has dementia, we need to be generally welcoming in all that means, but not too inquiring, not putting people under pressure to respond to questions, because that might make them feel very anxious. All those complicated things you've described. We just need to be welcoming, and we can all do that. It doesn't require a special training, does it? It just requires us to be in the moment, and make contact with a person in the moment. Hello, it's nice to see you. Not hello, where have you come from today? You know, that's a different question, isn't it?
Yeah, not asking is that, you know, if they're visiting from Egypt, how long they've been there, things that are really, you know, could be quite challenging to answer if you've lost your sense of time and how to measure it. Then yeah, just sticking to tea and coffee and biscuits is much simpler.
And I do think, I'll shut up and then other people can ask questions. I do think that families are encouraged when you just show that general hospitality and welcome. When you say to someone with dementia, hello, I'm really happy to see you, you know, even if you've never met them before, I think that that's a positive and supportive message to the family as well, isn't it? Is that true?
Absolutely.
Yeah. Anyone else? Comments or questions, please? That's a really fantastic presentation. I enjoyed it very much. It's going to be very useful for others to watch. But does anyone else have a question or a comment right now?
Yes, thank you, Abuna. Thank you, Maha. This is absolutely fantastic. I think a lot of families are going through this, and you touched on something very important, that every elderly is different with their dementia. I personally think when a person is Arabic speaking, their dementia is completely different from an English speaking. Unfortunately, sometimes a person with dementia gets very hard to handle, where you might need a home. And unfortunately, there's no homes for Arabic speaking elderly people that can relate to the music. It's so difficult because I believe as they get older, they want more of the life they lived as a child. And it's all about the Arabic life, the music Arabic, the talking's Arabic. And unfortunately, I don't think there is a home, or is there? This is my question. Is there a home for Arabic speaking elderly that have dementia?
I don't know the answer to that. I'd have to do some research. I haven't come across one. I know that there's a Jewish one, so it's quite possible that there could be one for Arabic speaking people, but I'd have to check. I think, though, on the music thing, I think that a good British care home, they would, just because they wouldn't be able to understand the Arabic, they would still be able to find out from you or the person sort of what music that person listened to and play that music, but they wouldn't be able to understand, and they certainly wouldn't be able to communicate. Although some homes in some areas may have Arabic speaking. So I think it would need a bit of research. I think that, you know, some of the best homes probably could still do a lot. I think you'd be surprised how much they could do, even with that context. But I'll do some research and I'll ask around and get back to you. If that's
Thank you. Lovely. Thank you very much. Thank you.
Yeah.
Does that illustrate how, I mean, the idea of these mental health presentations wasn't just so that we could learn some information. It was so that, especially in our Diocese of the Midlands, but wherever people are joining from and listening to this later on, how can we apply it to our congregations? It does make me wonder whether, because that's a real situation, how a ministry of people who were concerned to support families and elder folk with dementia, many of whom might naturally speak Arabic from our church community, whether there could be a ministry in some way in the future that provided that support, visited not only families visiting someone, but while it was still appropriate and possible, being attached to care homes to provide an Arabic language support, you know, having proper training as you've been through, you know what I mean? It's my hope that some of these presentations, some of our conversations and concerns will develop into real practical ministries that support people. And it may be that we're not big enough yet to have our own care homes for dementia, but there's no reason why in the medium term, not the short term perhaps, we couldn't have support for families that is trained, proficient, you know, not necessarily clinical, but providing some of this cultural support which elders from an Egyptian and Arabic background might require. Is that true at all?
Yeah, definitely. And actually, the way that the Jewish care village works is the staff are still, you know, it's still very, because Belong operates a Jewish care village. So in that context, they do it in partnership with the Jewish Trust, and they actually provide a lot of the volunteers who come to run the cultural activities and the prayer, you know, the rabbi visits, and there are prayers. And so I think definitely having volunteers from our community who went to visit people in a care setting where that was relevant is something we could definitely do as a ministry from the church that would have a great value. And those, you know, the visits don't have to be religion based, because it could be as simple as a coffee morning, but it would be in Arabic, so they would be able to communicate. You know, it's about maybe
Absolutely.
similar activities, but in a language that the person can understand.
Absolutely. Our ministry isn't just on a Sunday morning. This is, again, what's important, certainly to me. Our ministry isn't just on a Sunday morning. If you come to church, we'll find someone to talk to you in Arabic, but it must be every day of the week in one way or another, you know, that we are concerned for those with need in our community and outside our community. That's very, very positive and encouraging that you already have such volunteers in a Jewish context. That tells us that something would be possible in the medium term in our diocese in an Orthodox context. That's fantastic. And anyone else, a comment or a question, please? One or two more. then let me ask, for you as someone working in a village that's focused on people with dementia, what's the biggest struggle that you and others working in ordinary day-to-day care would experience?
I think the biggest frustration is just people want to be able to spend more time, and they don't always, in a work context, have that time because they're supporting a number of different people, or they're there to do some work sort of objective. So I think, and I do think that that's where as well, volunteering and going and visiting and spending time with people, if we can. I think when we talk about, when you were saying what we could do if we knew someone in our congregation had dementia, then actually visiting that family and, support, finding a way to visit and give the carers a break, or to give other family members a break. I think those are things that can be really helpful, because it's really, really draining for it's 24/7, I guess. In a work context, you work on a shift and then you get a break, but people who are supporting people at home don't get that break. So I think that that's something that is probably a practical way that people could help people as well.
I have one person in my own church in Liverpool who I try and take communion to him in his home once a month, and his family try to ensure he comes to church once a month. And this is one reason why I did myself. Just one thing I will say here. I did a providing dementia care course. It's only very low level. It's nothing that makes me anything at all. It's equivalent to an O level, a GCSE basically. But over 3 months, I did quite a lot of work, and it gave me a lot of insight into my care for this one person in my church. It's not beyond us also in our diocese to sponsor such courses for autism as well, for other mental health conditions, where we have members of our community who are studying a formal, very low level qualification to better equip us. I found what I've done really helpful in my own very ordinary interactions with people in church. And it might be that we need to become better prepared as a community through gaining further education ourselves, not only being generous and kind volunteers, but undergoing some of the training that Ma has had to make us better equipped in our service. Would that be something also in the midterm that might be something good for us to have a course run within our diocese by someone from outside, probably, so that we become, some of us at least, better equipped? Is that an idea?
Yeah, I think that's even within the villages, we have what we call dementia champions, because not all residents have dementia. And so having certain people that are kind of more qualified or more experienced, and then they can help advise and support other members of the congregation who don't necessarily have that level of background.
Thank you very much for that, Maha. It was a really wonderful presentation. No, it was really useful, and I'll be recommending that many people in our congregations watch it. It's been recorded, and I'll stop the recording now.